to explain the definition of tuberous sclerosis complex, or also known as TSC. Tuberous sclerosis complex is a rare genetic disorder that affects multiple organs in the body. It is caused by mutation in either the TSC1 or TSC2 genes, which normally help regulate cell growth. When these genes do not function properly, cells can grow uncontrollably, leading to the formation of non-cancerous tumors, also known as hematomas. One important thing to note is that these tumors are benign, meaning they are not cancerous. However, even though they are non-cancerous, they can still cause serious health problems, depending on where they are grown and how large they become. TSC does not affect just one part of the body, but rather multiple organ systems. The organ most commonly affected by TSC include the brain, skin, kidneys, heart, lungs, and eyes. In the brain, these abnormal growths can interfere with normal brain function, which is why many individuals with TSC experience neurological symptoms. On the skin, TSC can cause visible skin lesions, which are often one of the earliest signs of the condition. In the kidneys, tumors or cysts may develop and affect kidney function over time.
Tuberous sclerosis complex is also known as TSC is caused by mutation. Tuberous sclerosis results from mutation in two tumor suppressor gene, which is TSC1 and TSC2. TSC1 is the gene on chromosome 9q34 will produce hamartin, and TS2, the gene on chromosome 16p13 will produce tuberin. TSC1 will combine with TSC2 to form a protein complex. This protein complex inhibits mTORC1, which help in cell growth, cell size, cell division, and metabolism. TSC2 mutation will frequent loss of heterozygosity for allele in 16p13 and rare loss in chromosome 9q34 has been found. So, what happens when mTORC is overreactive? First, cell divide into uncontrollably. Second, overgrowth in kidney, skin, lung, and heart. Third, cell growth too large. 4. Deorganized brain development, and the last one is abnormal tissue growth. In summary, the key of mechanism is first one is mutation in TSC1 and TSC2, and body will lose hamartin and tuberin, and inability to inhibit mTOR will lead to uncontrolled cell growth, and the benign tumor will multiple in organ. That's all.
This is the main symptoms that can vary widely and may appear during infant, childhood, or adulthood. The first one is seizures. Seizures are one of the most common features of TSC. These occur due to recurrent abnormal electrical activity in the brain and may include different seizure types. Next is developmental delay may be seen. Children with TSC can experience delay, cognitive development, and motor skills affecting learning and daily activities. Next is autism and ADHD. These are common neurodevelopmental conditions associated with TSC. These may cause behavioral challenges, social difficulties, and problems with attention and focus. Other symptoms can be kidney tumors and cysts are frequently found in TSC. These are usually benign growth, but if they enlarge, they can lead to complications such as pain or kidney damage. Next, skin lesions are common and often help in diagnosis. These include rash and light colored patches on the skin. Besides that, lung disease may occur especially in women. This condition can cause breathlessness that worsens over time. Next is cardiac rhabdomyomas, are heart tumors commonly seen in infants with TSC. These tumors are usually benign and may shrink as the child grows. Finally, eye abnormalities may occur. These include retinal problems that can affect vision.
Tuberous sclerosis complex, or TSC, is a genetic disorder that affects multiple organs including the skin, brain, heart, kidneys, lungs, and eyes. Because it involves many body systems, doctors usually begin the diagnostic process by observing clinical signs rather than starting immediately with genetic testing. The first step is initial screening and clinical assessment. doctors perform a physical examination, paying special attention to the skin. Some of the most common skin features include hypomelanotic macules, also known as ash leaf spots, which are light-colored patches on the skin. They also look for facial angiofibromas, which are small reddish bumps on the face, a chagrin patch, which is a thickened area of skin, usually on the lower back, and ungual fibromas, which grow around or under the nails. These skin signs are often the earliest and most visible clues of TSC. Next, doctors use medical imaging to check whether internal organs are affected or not. A brain MRI or CT scan is done to look for abnormalities such as cortical tubers, subependymal nodules, or subependymal giant cell astrocytomas, which are common in TSC patients and may cause seizures. A renal ultrasound or CT scan is performed to detect kidney problems such as angiomyolipomas or cysts. In infants, an echocardiogram is used to look for cardiac rhabdomyomas, which are benign heart tumors. For adults, especially women, a lung CT scan may be performed to check for lymphangioliomyomatosis, or an eye examination is also done to identify retinal hamartomas. These findings suggest TSC. Doctors then move to the next step, which is genetic confirmation. Genetic testing focuses on two genes, which is TSC1, which produce the proteins hamartin, and TSC2, which produce tuberin. Mutations in either of these genes disrupt normal cell growth control. The most common method used is next-generation sequencing, which detects small mutations such as substitution or insertion. Another method called MLPA is used to find large deletion or duplication in the genes. Finally, Sanger sequencing is often used to confirm any suspicious variants. Importantly, identifying a pathogenic mutation in either TSC1 or TSC2 is enough to confirm the diagnosis, even if the patient does not yet show all the typical clinical signs. This allows for early diagnosis, proper monitoring, and better long-term management.
CT computed tomography or MRI, magnetic resonance imaging, ultrasounds, and electrocardiogram ECG are among the tests used to diagnose tuberous sclerosis complex (TSC). TSC may initially manifest as seizure and impaired development. TSC can also be diagnosed by closely examining the skin, nails, teeth, gums, and eyes for signs of the condition. When a TSC diagnosis is suspected or uncertain but cannot be clinically verified, gene testing is advised for genetic counseling purposes. For brain treatment, after magnetic resonance imaging MRI of the brain every 1 to 3 years in asymptomatic TSC individuals under the age of 25 to monitor for new occurrence of subependymal giant cell astrocytoma (SEGA). Patients with large or expanding SEGA or SEGA causing ventricular enlargement but remaining asymptomatic should receive MRI scan more regularly. Acutely symptomatic SEGA requires surgical resection. Severe spinal fluid diversion (shunt) may also be required. Growing back asymptomatic SEGA can be treated with either surgical excision or mammalian target of rapamycin complex mTOR inhibitors. Get an MRI of the abdomen every 1 to 3 years during the patient's lifetime to check for the development of renal cystic disease and angiomyolipoma. In individuals at risk for LAM, typically female 18 years of age and older, history at each clinical examination should require for any symptom of exertional dyspnea and shortness of breath. In select LAM patients with moderate to severe lung disease or rapid progression, treatment with an mTOR inhibitor may be used to stabilize or improve pulmonary function, quality of life, and functional performance. Treatment for heart. Pediatric patients who are asymptomatic get an echocardiography every 1 to 3 years until the regression of cardiac rhabdomyomas is confirmed. Every 3 to 5 years, asymptomatic people of all ages should have a 12-lead electrocardiogram ECG to check for conduction problem. For individuals who had previously been diagnosed with ophthalmologic lesions or visual problems during the baseline evaluation, do a yearly ophthalmologic evaluation.
TSC is a chronic illness. Although there isn't a cure for TSC at this time, there are therapies to assist control its symptoms. Cannabidiol has been licensed by the U.S. Food and Drug Administration (FDA) to treat seizures in individuals with TSC, with the exception of infants under a year old. Everolimus, an mTOR inhibitor, has also been licensed to treat some brain and kidney tumors linked to TSC as well as intractable seizures, those that are not effectively managed by the medication.
Conclude, tuberous sclerosis complex is a rare genetic disorder characterized by the growth of non-cancerous tumors in multiple organs. Although it is not contagious or malignant, it can significantly affect a person's quality of life, making early diagnosis and proper management very important.